So this is in honor of Native American History Month. We wanted to ask a alum come in and talk about her pharmacy career journey. We always provide a pharmacy journey from one of our alum to come in. So we're very thankful to have Dr. Amber Walks Over Ice come and speak on behalf of the Native American Center of Excellence. She was also part of the program at one point. So please help me join in welcoming her to speak today.
All right, good morning, everyone. My name is Amber Waxbryce. Before I start my presentation, I do want to put out a couple of disclaimers out there that what I will be discussing today is just clearly my journey, my educational journey, my career journey, and what I say may not necessarily represent the views or ideas of Indian Health Service or some of the other entities that I'm talking about. I'd also like to say that although I have given other presentations in different areas in the professional setting where I'm talking about medications or I'm talking about policies, this is actually my first presentation talking about myself. So it's a little bit different. It's a little bit humbling. It is humbling to come in and talk about myself, and it's not something that I normally do. And so I would like to say thank you to all of you for attending, and thank you to the Native American Center of Excellence for the invitation. I'm truly honored to be invited here to speak to you today. All right, let's get into a little bit about me. So I'd like to say I am a proud member, enrolled member of the Confederated Salish Kootenai Tribes. I grew up just down the road on the reservation. My family comes from the Arlee area. I grew up in both Arlee and St. Ignatius. I grew up very involved in my culture. My mother kept us doing many cultural activities, powwow, stick games, our cultural events in the wintertime. And so a part of being Salish and participating in my culture has been a big part of my life. Also, my next title is I'm a mom, actually a teen mom. I am a proud mother of 5 beautiful children. I have 5 kids, 4 sons and 1 daughter. I became a mother at the young age of 16, and I'll talk a little bit about that as we go through. I actually had my older 2 before I even graduated high school. And so although it did provide its challenges, it creates who I am today, and I definitely wouldn't change who I am about that. I am also a wife. I have been very fortunate and I've been blessed to have married my high school sweetheart, who is also my support system, my shoulder to cry on, my chauffeur. He drove us across the state this morning. He got up early. He allowed me to get some rest so I can be here to present to you all. So I thank him for everything that he has been done. I will say I'm a grandma, so that comes along the territory with Kala. That's what my grandbabies call me, Kala. I have 3 beautiful grandbabies, 2 granddaughters, 1 grandson, and I have another on the way. Not sure the gender yet, so we're very excited to be welcoming another member into our family. I'm a daughter. I am a daughter. I have 5 siblings. I was raised by a single mom, raised in a single parent household. My mom has definitely been my inspiration. The strength that she has shown to me as a younger person that would get up every morning, take care of all of us, and just get things done. Wasn't always easy. There's definitely struggles with that. But you know, I give a lot of credit to my mother for that. I put granddaughter in there because that's also important, because because my mom was a single mom. I should say her name. Her name is Roberta Decker. I'm very proud of her. My grandparents are the late Vic and Delma Bodine Matt, and they played a huge role in my upbringing and also into my education, and they are a support system. I am a sister. Like I said, I have 5 siblings. I am number 4. I'm actually the first girl. And so a little bit of the attributes that I have come from that. And some of that is I have 3 older brothers. And so part of that is that they made me tough. You know, having 3 older brothers, they rough you up. You're pretty tough from that. So I would say like a lot of my strength and my toughness comes from that. also created another attribute that I have. I can say, honestly, probably a little bossy. You know, I have brothers who always waited on me hand and foot as a little girl. Being the first girl and having all boys created a little bit of bossiness within in me, but they also can put me in my place. So I think I have a good balance with that. And where that will lead into, you'll see a little bit later on in my presentation of that. And lastly, and on purpose, I put pharmacist. And the reason I put pharmacist as the last thing as who I am is because the roles that I just described and the support system that I have within those roles actually shaped me into the character that I have and the attributes that I provide as a pharmacist, that I provide as a pharmacy supervisor, that I provide as a pharmacy clinician. And so that all encompasses who I am as a pharmacist. And I wanted to give credit to that support system because a lot of the times when I'm making decisions, I hear my grandparents in the back of my head. Amber, remember who you represent. Remember what you're there for. I hear my older brother, hey, you know, you're there to get a job done. You're there to take care of the people. And it might not always be easy, but there's a purpose in it. And sometimes you have to take that hard road. So I just wanted to give credit because I do have those roles and how they attribute to who I am as a pharmacist. Next, my education. I probably should have put my high school, where I graduated high school from. I graduated high school from St. Ignatius, our mission high school. And the reason I should have put that is because as a teen mom and as having two children, I had people doubt that I would even finish high school. I had people come up to me and say, oh, are you going to get your GED? And you know, not discrediting people who go that route, but that just wasn't the route for me. And actually having my kids actually pushed me to want to do more and do better. I started off at Salish Kootenai College. I started my prerequisites there. I really enjoyed the college. I was able to network and navigate with other Native students, and it was really a good start for me. It really provided a good foundation of the prerequisites that I needed. However, at that time, there wasn't very many programs, bachelor's degree programs per se. There was just a handful. Now it has really evolved and developed into a really great tribal school. But at that time, they didn't have many. And so within that, I really excelled in that environment. And I actually got a Bridges to Bachelor scholarship to Rocky Mountain College. And I had transferred to Rocky Mountain College. And that's where I earned my Bachelor of Science degree in biology. And as part of that, and as being in college, we don't really have our minds made up of what we're going to do. And so when I first went to college, when I first went to Salish Kootenai College, it's like, hey, I want to be a lawyer. My older brother's an attorney. I think that's what I want to do. First quarter, absolutely not. That was not for me. It was not for me. I was kind of good at math, a little bit good at chemistry. So it's like, hey, I really like the sciences. I really like the medical field. I didn't mention it in the beginning, but my firstborn had some medical conditions when he was born, and so he underwent a ton of surgeries, and so I had a lot of exposure to the medical field, both within the tribal health services and both outside. And so it was hard to navigate, especially being young. And I was like, you know, I want to be able to make a difference. I want to be able to do something that would make a difference. And so then my next choice is, all right, I want to do medical school. And so that's hence Rocky Mountain College and getting the Bachelor's of Science in Biology that I did do a straight track through pharmacy. Was able to finish at Rocky Mountain College, actually got into a program that provided services to expose me to that medical field as a physician. They sent me to the American Indian Physicians Conference that year. That was actually in Nashville, Tennessee. It was great. It was super good exposure, a lot of different networking, but it provided, it allowed me to do like a mock MCAT, do mock interviews into medical school, but it also provided a timeline. And when I looked at that timeline, I thought, wow, this is great. I'm interested in this, but I'm going to miss so much of my kids' lives. My kids are so important to me. This isn't for me. This, that was really that conference that told me, okay, backpedal a little bit and maybe try something else. And so with the different support systems that I have throughout my family, I even say my powwow family, because when we powwow and travel throughout the summer, I talk to some people and I'm like, hey, how are you doing? How's school? They all take care of you. And they're like, have you thought of pharmacy? I have relatives, I have siblings, I have people who are in pharmacy. Like, no, actually, I have not. And so let me look into that. And I did, and it actually seemed like a really good fit. The timeline was amazing for my family life, and then I could still be there to provide medical care and assistance to Native people. And then finally, the University of Montana, I like to say they took a chance on me. Doctor of Pharmacy program. It was a little bit grueling. I was really nervous about it. The application process was, I would say I was honestly a little bit of a nervous wreck with that, but I made it through, did the application process, did the interviewing, made it through the different cuts that you have to make it through to be one of the 65 to be in the class. And so I was very honored to be selected to be in the pharmacy class. Next, pharmacy school. I was an Indian Health Service scholar. I knew all along that I wanted to come back and work for, I'll say, my people, tribal people. And we're all a big family wherever we go, and we travel extensively. My family likes to travel. We travel extensively all throughout Indian country. And so I just knew I wanted to be somewhere to work with Native people. If I could be at home, great. If I could be at my husband's home, great. If we had to move somewhere else, so be it. But as long as I was able to be within the Indian Health Service, that was the plan. I'll also be honest with you, my first year of pharmacy school was a disaster. Um, Somewhat of a disaster, I'll say. I excelled, but it was a little bit of a disaster. Although I grew up just 50 miles down the road, coming into the pharmacy school was a huge culture shock for me. It it, it hit me hard, and I had a hard time finding my place as one of the only Native American students in the pharmacy program. Not only was I one of the only Native American pharmacy students, I was also a mother, so I was a non-traditional student. I was not living on campus, and it it was difficult. I put some other things that I've done, so I I tried to find where I fit in best. I reached out to, I became very accustomed to the American Indian Student Services. At that time, it was in the Lamison Center. The pain was still under construction at that time. So I found a home there. I also found a home within Kiayo. Not necessarily saying that was the best choice for me, but that's where I could relate the best. It's a big part of who I am and how I was brought up. I actually maybe shouldn't have, but I was actually the vice president of Kiayo my first year of pharmacy school. Turned back time, would I do things differently? Maybe. I don't know. I can say it created a lot of extra stress that I probably didn't need as a first year pharmacy student and struggling, but I also was able to find like a place of belonging and home. And so I'll give credit to that. The Native American Center of Excellence, that I have to give credit to them. They've actually provided a lot to my success in pharmacy school. They were able to work with me and help me reset after that first year, and help me get back on track. I, after talking with the many support services that I had, not only the American Center of Excellence, the dean of students at the time, she sat down with me and she was honest with me. And she's like, hey, Amber, I know you want this. I know you will work hard, but we got to make some changes. And I took that and I'm like, okay, let's make some changes. And so she helped me rework my schedule. She listened to me and she helped me work my schedule to where I could do my family things and still do school. What happened is I was in two classes. I was in my first class and I was also in my second pharmacy class. I was kind of embarrassed about it, honestly. It's like, gosh, I'm even more different now, right? And it made it hard, but it worked. Actually, in the end, like I cried. At that time, my husband probably tell you I cried a lot in pharmacy school, and I'm really good about it. But I was like, gosh, just another thing to make me different. But actually, that it was that second class that I became accustomed with. And no knock on my first pharmacy class, it was so competitive. Everybody was just ready to compete. But that second pharmacy class that I became a part of, they called our class of Pharm.D. We all took care of each other. We studied together. I was included. And that's exactly the environment that I needed. And I'm really happy for that. I, I can say sometimes we're proud, but I took on the tutoring services that the Native American Center of Excellence provide. They help get tutors for me. They help put me in groups, and those really helped me succeed. Um, within the program, it helped me keep my Indian Health Service scholarship. I had many conversations with them. Conversations, this is your job. You need to maintain. So after that, my GPA, I maintained what I was required to maintain, a B average in the pharmacy school, if not better. I became competitive with others. I wanted those top grades, and it was all because of the support systems that I had around here. It just took me a minute to find them. And after I found those support services, then I was really able to succeed. Put lots of miles on my car. I still lived on the reservation. My family remained there. We would get up in the morning. My husband would go one direction. I would go the other. My husband is a teacher. He earned his degree at Salish Kootenai College. And so we would get up, we'd get our kids ready. He would go to school to Salish, and I would come to school here. And we lived in St. Ignatius. We lived in Indian Town. And it was great because after I left here, I still had that sense of community, and I was surrounded, by my own people, which was nice. But it was 50 miles one way. I did rework my timing, maybe get here early. There was times where the roads were bad. The Everett Hill is not the best. So and the parking, the parking is so much fun, right? You feel like a vulture because he's like, oh, they're going to their car, and trying to find the best parking. So I got used to parking way away and just getting my steps in, and just knowing I was going to have a 10 to 15-minute walk to my class every day. And that's really what helped me. Caffeine, I think all of us students know, we survive off of the caffeine that we need, and a lot of sleepless nights. I know we all experience that as students, but when I left the school, I would go home. I would put my mom hat on, take care of my kids, get them fed, get them to bed, get their homework done, spend a little bit of time that my husband and I, that we could, he was a student as well, spend that time together, a half hour maybe, and then we would study. We would start studying to 2, 3 in the morning, go to bed 6 a.m., start all over again, if not before, especially when you had those 8 a.m. classes. My career journey. So I just contract care on there because I did talk about having, and I put that as because that was kind of like a little bit of a, not necessarily kind of a stopping point, but a resting point maybe for me. So I worked for the Indian Health Service contract care, and I think now it's called purchase referred care in St. Ignatius. I did that for maybe a year and a half. And during that time, that's when I was applying to pharmacy school. But it was kind of just a little bit of a resting point for me to really find what I wanted to do. And that's when I said, after I attended that American Indian Physicians Conference, it really set me on the right path. Confederated Salish Kootenai Tribal Health, that was actually my first pharmacist job. And I worked at the Tribal Health Pharmacy in St. Ignatius. I was probably one of the best years. It was the perfect year to have as a first-time job. I love my job. I love the work environment, and I loved all the people that I worked with. I was really happy at work. However, I was not as happy at home. My husband had already graduated by that time, and he took on a position on his own home reservation, which is the Crow Reservation. And there just wasn't any jobs open for me on the reservation over there at that time. There wasn't any jobs open here for him at that time. And as students and as parents, we needed to have a source of income. And so we were driving back and forth to see each other. We had 2 households. He would come one weekend, I would come the next. Our kids, you know, I had the baby, he had the older ones because of the school system that he was in. It's an amazing school system that he is there. And so we had plans, you know, we wanted to be here. We love the area here. He was here with me. He went to school here. I wanted to stay there. I was very well, I mean, it's my own tribe. I was very welcome there, very well perceived. But sometimes God laughs at our plans, right? So everything uprooted. So after all the driving, and we were both just miserable, you know, only seeing each other on the weekends, it got harder and harder. We would leave later and later when it was time to go back to our jobs. And so we said, all right, enough's enough. We'll both apply in both areas. And we did. And the deal was whoever gets the job first, that's where we'll go. And actually, I applied to Crow, and it felt quick. You know, they interviewed me, and you'll see a little bit later as supervisor and HR process is a little bit of a different story. I was on site in 6 weeks, which government time, IHS time is unheard of. I was nervous about the transition just because that wasn't in my original plan. That's you know, not what I wanted to do. It was different, but they did offer me a home. This is my current professional home, and it has been for the last 10 to 11 years. This is the Crow Northern Cheyenne Service Unit. This is the main hospital. It's a critical access hospital. It provides 24 beds, provides the services of inpatient, ER, outpatient services, pharmacy services, dental services, optometry services, laboratory services. Everything is all in one house. And it's nice. It's good for our patients to have that access to care, to where they can go and there's teams working together and they can be seen. Part of the Crow Service Unit, we also have 2 field clinics. The field clinics, we have one at one end of the reservation, which is they're both at each ends of the reservation, I guess, but one's in Lodgegrass, which is near the end, close to the Montana-Wyoming border, which is right at the end of the reservation. And then the other side is in Pryor, which is a lot closer to Billings. They're very remote. The drive from Crow to Pryor is an hour, a little over an hour. If you were to drive from Lodgegrass to Pryor, you have an hour and a half drive. And so it definitely has its challenges. Honestly say I didn't want to be there, but it's became home and I've been very welcomed. I wish I would have provided a map of the Crow Reservation. They always say home is where the heart is. My heart is in both places. My husband's Crow, my children are Crow, my grandbabies are Crow. And as soon as I got there, the patients, the community, they were so welcoming. And they welcomed me in basically with open arms. Who's your family? Who's your husband? Oh, I know that person. And even though I'm not Crow and I'm Salish, they may have known my grandparents. Oh, your grandpa's Victor Matt. I know him. Or your grandma. I know your mom. You know, your mom and I, we grew up together because my mom also traveled around, you know, with her parents doing the culture stuff. So it provided some comfort to a little bit of the distress that I had of moving. But like I said, it just right now, it felt right. My roles currently, I have several roles as a pharmacist, honestly. You know, we staff, we see patients. These 2 roles, you know, I didn't think when I was in pharmacy school that I would ever have either of these roles. Honestly, I wanted to get into the pharmacy. I wanted to do outpatient pharmacy. I wanted to counsel patients. I wanted to hand out medications. And it just quickly evolved into being a clinical pharmacist practitioner and into being the director of pharmacy. I do both. I do a lot of everything, but I wanted to separate these 2 out because although I was hesitant at first to go into either role, my supervisor at that time seen something in me. I don't think that I did, that I seen in myself. As a clinical pharmacist practitioner, I He's seen how I interacted with the patients. He's seen the conversations that I had. He's like, hey, Amber, I signed you up. I signed you up to go to a training. You're going to go to a physical assessment training at Shiprock University, you know, that has a connection with University of New Mexico, where pharmacists are actually practicing as clinical providers. You know, and that's at that time that was big for that state, and it was big for IHS. And I was like, okay. I went, and just like school, it provided its challenges to me. I was nervous about it, and I came back and I was like, wow, you know, can I do this? You know, like there's a lot that goes into it.
Can you say more about what a clinical pharmacist practitioner is? What are the job responsibilities? Sorry to interrupt.
No, fine. Great question. Clinical pharmacist practitioner within, it's becoming more and more known. It's where you can actually practice as a mid-level provider. You can see patients. You can write prescriptions under your name. It's chronic disease state management. The hindrance that you have there is you can't diagnose, right? We're not trained to diagnose, but we're really well versed in chronic disease state management. We're really well versed in the medications that we provide, medication therapy management. So as a clinical pharmacist practitioner, there's different specialties that you can do. What I do as a clinical pharmacist practitioner is really focused on chronic disease state management. I work a lot with diabetes, hypertension, hyperlipidemia, Hep C, STIs. In a certain sense, we do have a couple pharmacists within the pro service unit now who are have credentialing in HIV and some of the PrEP things. And we have a pharmacist who's privileged residency trained in behavioral health. And so it's really at your comfort level. And when I say, and I put privilege and credential, is because that is something that has now happened for pharmacists in the Billings area Indian Health Service. And I was able to obtain that privilege and credentialing by showing the trainings and the background of what I have and the mentorship that I have of providing care to patients. So it wasn't just something that happened overnight. I just didn't go to training and then start seeing patients. I had a mentor. I had people mentor me and say, okay, this just like you do in school, right? And now I'm comfortable enough to where I do a lot of that on my own. I do 1 day a week. I'm able to provide those services out at the Lodgegrass Clinic. I work in a patient-centered medical home model, PCMH, and I work directly with the providers in that team out at Lodgegrass. I tried to do that at Crow. However, as the acting director of pharmacy, I had too many interruptions. If exec knew or people, supervisors from other departments knew that I was in the facility, they would come looking for me, and I wanted to put all of my focus on the patient. And so I found that it worked better for me to provide those services out at the field clinic. And so I provide those services 1 day a week out at Lodgegrass. Do, however, have pharmacists who provide that care at Crow every day. And we are working on developing services to move our clinical pharmacy practitioner to the prior clinic as well. We'll say that the pharmacists that we put out there, we don't just put anybody out there. We make sure that they have the training in the background. I am a patient at the facility, my family's patient, their patients at the facility. And of course, we want top-notch care for all of our patients. And so it's something that we're really careful about with our selections. And there's a mentorship that we mentor them through that. And it was a little bit difficult to develop because it was new to Crow. It was a new service that we were able to provide. And so basically worked really hard to develop those relationships with our patients, the providers, and the staff all around us to develop that service. Next title is what I do a lot of the time. I'm director of pharmacy. We have currently at Crow, there's 18 pharmacists, 2 pharmacy residents, so that's 20 pharmacists, but they're part of the residency program and they're still learning. 8 pharmacy technicians. Within that, like I said, there's 3 outpatient pharmacies. Pharmacy provides services in inpatient. the emergency department, within behavioral health, and then in the patient-centered medical home, which I talked a lot about. I wish I would have did a slide on a timeline. And I thought about that on our drive over. It would have been really nice to provide a timeline. When I first got to Crow, there were 6 pharmacists. Six pharmacists, including the supervisor. The pharmacy department, all the pharmacists rotated through outpatient and inpatient. Our inpatient services were half a day. We would get there, we'd go take care of the patients on the inpatient ward. Afterwards, in the afternoon, we'd come down and we'd help in the outpatient pharmacy. We process on average anywhere from 600 to 800 scripts a day. Had the technicians, we did half days on the weekends, and we all rotated through. And over time, you know, I will not take full credit for all of the development, but I like to say that I have been able to be a part of the pharmacy supervisors team to help in the decision making, to help in the goal setting for the department and expanding the services. So since then, and so let's see, I've been there 10-ish, 11 years now. And if I look back, it kind of sounds like a lot of time, but it's actually happened fairly quickly. We now have an accredited residency program, and recently able to add on 2 residents. Have great people, great deputy chief pharmacists that I have as my deputies who work really hard in getting that program up and running. I was there as support. I was there to help sign the paperwork and a little bit of guidance, but it's you know, I'll take the credit. It's like, hey, I'm really supportive. I want a residency program. I've seen what it can do for the facility. I've seen what it can do for our patients. Let's move forward and let's do this. We now have a dedicated pharmacist in inpatient, and we have a dedicated pharmacist in the ER. And we have, let's see, I should back a little bit, because also at that time, our 2 field clinics were only open part-time. 2 days in Lodgegrass, 3 days in Pryor. And you would have that one pharmacist who would rotate. They would be the one to rotate to those field clinics. Can now proudly say that both of those pharmacies are open full-time, right with the clinic. So our patients don't have to wait. Is it Tuesday? Is it Thursday? Do I have to get my meds? They can go in anytime that clinic is open and receive their medications. We were also not big on taking outside scripts. I mean, that's a little bit of a touchy subject in IHS, but we're like, hey, you know, our patients do go out. We have increased our staffing. Let's take some of those outside scripts. And so we now take outside prescriptions, and we're calling providers if there's any discrepancies. And so we've really built the pharmacy department into something that I'd say I'm proud of. I was proud to be a part of that goal setting. I'm proud to be a part of the process of growing so we could help the patients of the Crow Nation. We serve both the Crow and the Northern Cheyenne. Patient population was around like 15,000 people, and just having the understanding that having access is hard, and if we can help with providing the extra access and help provide the expertise, be in a position to increase patient safety and so where they can get all their services in one place. And I mean, that's great, right? That's good patient care. Like I said, I am a patient there. My kids are patients there. My grandbabies are patients there. So when I'm making decisions regarding patient care for the pharmacy department, I always have that in the back of my head. I want the best care, not only for myself, but for everyone. I am a patient just like everyone else. I can relate to my patients because of that. I call early in the morning. I follow the rules. Just because I am a supervisor there, I don't walk up to the next supervisor, hey, can you get me an appointment? I call at 7 a.m. I call dental at 7 a.m. Because how else am I going to understand where we have any faults or discrepancies? How else am I going to understand what we can do to do better? I also do that as a supervisor. I work the line. I tech, I answer phones, I hand out refills, and I take pride in that because I want to be able to understand what my staff is going through and the improvements that we can make. I'm sure I missed a ton. This was a slide where I knew I was going to provide a lot of information. They would just want to say that we've had tremendous growth. I've had a lot of great help. I've had a lot of great people with me to help me along the way, and having the support system within my pharmacy department and within, some of the executive staff has helped. It has its challenges. Within the last 2 years, probably say our clinical director has changed maybe 6, 7 times. And so having to navigate through the change of leadership, re-explain myself, why we're doing what we're doing, why we're where we're at, it can be challenging, especially when they say, we don't want you here. Like, hey, we're established, see what we do. And just really being there as an advocate so we can provide great care for our patients, but also so we can create a happy pharmacy department and allowing them to practice at the absolute top of their license. We all deserve that credit. We put the time in at school. I talked about all the stresses that we have and how hard it is. So we deserve that too. Next, my family. I carried that tradition on from my second year of pharmacy school. So the foremost picture, you will on my right, you will see my 2 deputy chiefs, the deputy chief of inpatient and deputy chief of outpatient. Definitely lean a lot on those individual shoulders, and they've helped me a lot through 2 pharmacists, our pharmacy informaticist. She's great. I can go to her, hey, what do you think about this template? And one of our newer pharmacists, who just recently had a baby, so congratulations to her. And then this is just a snapshot. We have had some contractors, being short staffed, we're able to get some contractors in to help us so we can continue to provide those services. Had some contractors come in and help us. Now we have been able to get that staffing and get some pharmacists on, and I'm happy to say we'll be on-site pharmacy 24/7 services as of December 3rd, which is something we have not had. We are transitioning into having a pharmacist in the ER and inpatient, so there'll always be a pharmacist on site. So it doesn't show all of my team, but it shows a good portion of them. And then here's 5 of my 8 technicians. I just love all of them. I was like, hey girls, can I take you out and get a picture of you? And as crazy as it sounds, I am a pharmacist, but my technicians are also my comfort, because they are just like me. They're Native American. They do the same things that I do. And sometimes, when things get hard and I want to have a different conversation, I can go to them and like, hey, how's your kids? Are you going to this? Or what event are you doing? And I relate really, really well to all of them, and I respect all of them just as much as my pharmacist, but sometimes it's just nice to have that little bit of comfort. Some words of encouragement. There's something, I just put a couple things on there. Just because it's difficult doesn't mean it's impossible. Like I said, I had people doubt that I'd even graduate high school. And I'm not saying the road was easy, but I was able to get through and excel and continue to push through some of the hardships. And the struggles you feel today creates a success you'll enjoy tomorrow. Kind of giggle because I always used to, my husband and I both in school, there's a light at the end of the tunnel. Oh, it's flickering. I can kind of see it. Now it's a little bit brighter. We're almost there. And so it definitely comes quicker than you think. Keep grinding, keep pushing. Develop while you're in school, treat it like a job. Get here on time. Develop those attributes, those qualities of being on time, working hard, and being professional. Those alone will take you a long, long way. So those are some words of encouragement that I have for you. With that, that's all that I have. So what questions do you have for me?
If you could speak on maybe some qualities that you do in pharmacy that more culturally sensitive.
Sure.
Or practices.
So as a native patient as well, when I work with my patients as a clinical pharmacy practitioner, I am able to relate to my patient. My boys are hunters, so we eat game all winter long, and I love it. And it's lean meat. It's good. A lot of my patients do eat game meat too, and so we talk about, oh, did you fill your freezer? And it starts that conversation, and knowing that that's what they're having at home, knowing what kind of meals they're having, because sometimes, I mean, there's the nearest grocery store is a ways away. They have to travel. They don't always have that transportation. So having to utilize that and them realizing that, hey, the person I'm talking to, my provider, is actually cooking some of the same things at home, and talking to them about healthy meals, talking to them about exercise and how to incorporate that into their culture. Hey, did you go to the powwow? If you're not a dancer, if you're at the hand game, are you doing laps? I tease them, are you going around and trying to snake? And they giggle, especially the older ones. They think that's funny. Are you making sure you're seen? And so it's really good conversations. Understanding, we use a lot of the continuous glucose monitors, and a lot of our patients, I mean, it's a great source, but they fall off. And so having that relationship, hey, Amber, I went into the sweat. This is falling off. Okay, now I understand why you keep coming in and you're needing assistance with applying. So showing them the proper technique, using a skin adhesive, using some Tegaderm to keep that on so they can go into the sweat. I mean, we're sold, you can swim, ski, you can do all that, and it's going to stay on. Well, our patients, when they're going into the sweat daily, they don't necessarily stay on for the 15 days that they need to. And so knowing that they're doing that, I'm able to help them and like, all right, let's try this. And we usually find something that definitely works for them. Within the pharmacy department, food is always great. I mean, it's a cultural aspect that we have just as Native people. We like to gather, we like to eat, we like to celebrate. We try to not necessarily always the healthiest foods, but we make sure we give thanks for the food that we have. It keeps the morale up in there, and just understanding, like, if we have hardships in there, and having a clan feed is really a big part of the Crow culture. And so we at one point had a hardship. We just felt like, gosh, things just don't feel right. And so we all brought in some food, and we brought in somebody to pray over the department, and we gave away to them. We gave what we needed to, and we all felt better about it. And so just participating in with them and understanding it, because those are things that we do at home as well. It has really helped, not only within the department, but has helped with my patients when I interact with them, understanding that, hey, they may have some medicinal teas that they're using to help with the cold, and they're telling me this stuff is way better than those throat lozenges they're giving. Yeah, I understand. I believe you, and they're like, here, have some, and that they do work. And so just being open and being willing to listen, and showing, letting them in on a little bit of my culture and how I was raised, which they're all really similar. We're all very family oriented. That's how we are as tribal people. And as you can see, I talked about Pharm.D, making the environment that we're in seem like a family environment, and trying to bring all of those aspects in, from who I was and how I was brought up, with how I lead and how I represent. The grandpa always used to tell me, Amber, when you go out there, not only do you represent me, you represent your family. So there are times, where things get tough and I want to react in a bad way, and I stop. You know what? I'm representing my department. I'm representing myself, patients, but I'm also representing my family, and I will not, put any disrespect on my family's name if I can avoid it. And so it's definitely stopped me in my tracks sometimes. It's just having that upbringing of being respectful with where I'm at, and some of my responses to people. Yep.
Can you speak on, I guess, any like tensions or interactions that might happen with the patient population, with like seeing what is working like in the pharmacy, or like them dealing with those kind of like interactions?
So I can speak on it in a couple of ways. I actually seen a little bit more of it here on my own home reservation. I seen a little bit more of patients coming in and you don't understand what I'm saying, and talking, a little bit rudely to the pharmacist, and they were trying their best to provide great care and counsel. I see a little bit of it in Crow, but not too much. The patient population there, it's different. They're really well accepting. There have been frustrations, and I have been brought into the room, and when they do see me, it's like I didn't understand what they're saying. Crows, they still speak their native language. I mean, it's highly prevalent that they're going to come in speaking Crow. Well, a lot of the technicians that I showed you, they speak Crow too. And so if it's a misunderstanding and it's how they interpreted what was said, we come in and they're frustrated, obviously. I mean, they're waited an hour for their appointment, right? They get in, they see the provider. It's a new provider. And that's one of the challenges in IHS, especially at Pro right now. We have a lot of contractors. They're seeing a different provider. They're upset about that. It's a contractor. They're not used to our system. So we're waiting for the medication order to get in. We're waiting for their note to get in, because we don't process unless the provider note is in, because that's patient safety, right? We need to know the reasoning, and we call them like, oh, okay, did you mean to this? I mean, it creates, there's a lot of interventions that happen in between when they see the provider to when they get their medication, and then they're waiting on us. And so when they come to see us, we have a really good understanding that they're already upset. So the team that we have, they're really good at being able to calm and settle them. When there are misunderstandings and say it's a language barrier, that's where we have our technicians come in and help translate. It comes out differently. Like my technicians tell me all the time, it sounds different in Crow. When you say it in Crow, it can kind of have a different meaning. So let me interpret what you're saying, and we're usually able to work with them in that way. And so I see it, but it's not as often as you would think. I feel like they're very accepting of what they have and the care that they're being provided. And with pharmacy, because with having been able to maintain the same staff members, and so they're seeing a familiar face, and that's helpful because their contract provider might change from time to time. But when they come to pharmacy, that they know us. Oh, you helped me. I remember you. They actually bring us in pies and chocolates. They're like, thank you. And so it's not as much of a struggle as you would think. Not within the department. We definitely have our patient complaints. I mean, we're human. And when I talk to patients, I'm sorry, we'll fix it. We'll make this right for you. But there's some things that we can't do, and it's just helping them navigate through that process of when we can actually provide the services or the medication that they need.
So you feel like there is no like impact, like the cultural divide, like if it's not like a newcomer kind of still being accepted with that.
So I don't see what happens in their appointments with their primary care provider. I see them in between, and I have seen them come in frustrated. They do come to us frustrated, and it's like they didn't understand. And I have had patients tell me, okay, now I'm to you. I have to tell my story all over again. I told my story how many times, and it's just meeting them where they're at. And it's like, okay, I understand your frustration. I do. I get it. And that's where, like, if it's me personally, like, I'm a part of the same system you are. I'm just as frustrated as you are. And we are doing our best as not only the department, but as a service unit to actually change that. but change takes time. But how can I help you today? And just actually sitting there and listening to them goes a long ways. And making the time. They don't like being rushed through everything, and sometimes they're rushed through, and that's more so the bigger frustration than race. I would say it's just being able to navigate through that. But it looks like I told her, you're not going to have to hold your finger up for me. I can't talk that long. She's holding her finger up to me. So thank you all for attending. I appreciate you all coming here. And if you need anything, reach out to me. Contact information from Brittany.
Yeah, thank you everyone for coming. Of course, she'll be available to talk. You can feel free to come up and talk to her. If you haven't yet, please sign in, and thank you everyone who attended online. We appreciate it.